Addressing documentation burden in anesthesia practice, the role of anesthesia information management systems, or AIMS. My name is Jason McRoberts. I'm a third semester DNAP student at Keiser University, and this presentation is for my health informatics class. The anesthesia provider has several responsibilities, including monitoring the patient, providing medications and anesthesia, and effectively communicating with the surgical team. All these different things need to be documented, and documentation itself is important because it allows for communication, continuity of care, billing, quality improvement, and legal accountability. It is also evaluated to determine whether certain standards are being met. Ultimately, the responsibility of documentation falls on the anesthesia provider, and unfortunately this can take away from direct patient care. So what is an AIMS? Well, it's a type of specialized EHR that connects to different devices such as IV pumps, anesthesia machines, vital signs monitors, to automatically collect, store, and present information within the perioperative period. So many of these systems now include pre and post-op documentation, and many are capable of advanced features such as clinical decision support tools, and I'll build more on that later. Ultimately, these systems connect with the hospital EHR to merge the perioperative record with the overall health record of the patient. Standards and regulations. So the ASA, or American Society of Anesthesiologists, has different requirements when it comes to monitoring for oxygen, ventilation, circulation, temperature. One example of this is they require blood pressure and heart rate to be recorded at least once every 5 minutes. The Joint Commission is an organization that's responsible for accrediting hospitals that are compliant with its standards. Its standards focus on safe and high quality care. Within this, within their standards, includes maintaining legible and comprehensive patient records. If these standards are not met, a hospital could be deemed non-compliant or even lose their accreditation. So if they lose accreditation, they lose federal funding. This would mean no Medicaid and Medicare reimbursement. So this is a big motivator for hospitals and hospital systems to maintain compliance with regulatory standards, especially when it comes to documentation. Luckily for them, for those that have AIMS, these systems provide complete, standardized, and accessible data which complies with regulatory standards. One major concern when these systems first rolled out and became popularized was that an increase in automatically recorded data would lead to an increase in artifact and inaccurate readings. And they thought that this would present certain medical legal risks. However, research has shown that when these systems are used properly, it actually improves the documentation credibility because it reduces human filtering. And if you don't know what that is, it's basically when the provider goes in and cherry picks the best data to show that everything went perfectly. And when it comes to the artifact and inaccurate documentation, the provider is able to flag this data after the fact and manually enter any missing data if needed. There was one case that I read about where an anesthesia provider was going on break, gave handoff to the relieving anesthesia provider, got back from break 90 minutes later, and upon returning, realized that the vital sign data for the past 90 minutes had not been recorded due to a stream failure. Unfortunately, this case ended up with the patient having a poor outcome and ultimately a lawsuit. The lawsuit was settled, and what was likely a big factor in the settlement was the lapse in data. So because of this, some safeguards were put in place for these systems, including alerts. But at the end of the day, the anesthesia provider is the one who's responsible for ensuring that the monitors are correctly applied, data is being recorded, transmitted, and documented within ultimately the EHR. When it comes to patient safety, AIMS can be beneficial in several different ways. One of these is point of care alerts, specifically when it comes to allergies and drug-drug interactions. So this basically means that if I were to try to administer a medication that a patient was allergic to, it would flag it and give me a big alert. And obviously the goal for this is to prevent harmful medication administration. Another patient safety feature of these devices is clinical decision support tools. Basically what these do is they provide just-in-time information at the point of care. So an example is a built-in dosage calculation algorithm that takes into account a patient's weight and renal function. These increase patient safety because they reduce the likelihood of an error that may present itself during an urgent situation. Another example of a CDS tool is antibiotic redosing reminders, and these have been proven to dramatically increase compliance. Obviously, we want our patients to get their medications that they need when they need them, so this can help with that, especially when it comes to something as important as antibiotics, which all surgical patients receive. Additionally, AIMS increases patient safety by maintaining a complete and accurate record of perioperative care. This is important when it comes to other providers because they're able to go into the AIMS and determine how the procedure went. Maybe they want to look at how much fluid the patient received, or blood loss, or which medications the patient got. So for instance, a critical care provider could look up into the AIMS and determine how a procedure went. Additionally, this could be important for a future anesthesia provider who on a different admission wants to go back and look and see how the patient tolerated anesthesia, or if they were a difficult intubation, for example. Another factor when it comes to the completeness of the record that's beneficial is that this completeness allows for research and quality improvement, both of which you need quantitative data for. Security and privacy. HIPAA, or Health Insurance Portability and Accountability Act, requires safeguards to be put in place to protect patient information. And this includes the regulation of user access. So like EHRs, AIMS require authentication to use. And that means basically to sign into the AIMS and access data, you need to use a password, RFID chip, multi-factor authentication, biometrics, or any combination of these. Basically what this does is it ensures that the user who's trying to access the sensitive information within the AIMS actually has authorization and clearance to do so. These systems also have role-based access control. So this means that depending on the role of the person who's trying to access it, they're going to have different access limitations. So for instance, if somebody from the billing department was trying to log into the AIMS, they would have a different experience and access to different information compared to the surgeon, for example. Audit trails are basically chronological records of events in the system. They can tell you who accessed it, what time it was accessed, where it was accessed from, and what was actually done. These are important because they hold the provider accountable and they deter from any nefarious alterations or pre-documentation. An example of this would be if a provider failed to treat a patient's hypothermia and this led to an adverse event, and then that provider wanted to go back in after the fact and make it look like there was no hypothermia, this kind of thing would be easily recognized through audit trails. Because these systems store information electronically, they do present cybersecurity risks. They do contain a lot of sensitive information, and unfortunately, that has been a target in the past for things like hacking, malicious codes, malicious insiders, phishing. These attacks can lead to an invasion of privacy, ransom, operational downtime, financial losses, and legal repercussions. AIMS keeps data encrypted, so even if it does fall into the hands of a hacker, it would be unreadable unless it was decrypted first. Some other security measures that hospitals and hospital systems employ to increase their cybersecurity include intrusion detection devices, antivirus software, and firewalls. So when it comes to workflow processes, AIMS improves the individual anesthesia provider's workflow by improving efficiency. This is through automated documentation, as we've discussed. And basically, this decreases the manual charting that needs to be done, ultimately resulting in a lower cognitive workload so that the patient can focus on actually interpreting the data and caring for the patient. Say et al. Found that providers utilizing AIMS had a significantly lower self-reported mental workload when compared to their counterparts who were manually recording data. And although that may seem insignificant, case after case after case eventually builds up, and the provider is suffering from mental strain. At that point, he or she is more likely to make an error. So AIMS better enables the provider to decrease this mental strain, maintain focus, and maintain attention. Another aspect of workflow that AIMS can help improve revolves around perioperative handoffs. These time periods are vulnerable because information is being passed from one provider to another. So there's always a chance that either important information is being left out or inaccurate information is being passed from provider to provider, which ultimately both of these would put the patient's health at risk. AIMS helps solve this problem because it's accessible by both parties involved in a handoff. So a PACU nurse could look up the patient within the AIMS to understand what happened during surgery. For instance, they could look at medications, fluids, vital sign trends, labs, significant events, and basically familiarize themselves with the patient. And this would reduce the likelihood of an error and maintain continuity of care. Benefits versus challenges. Some benefits, we've been over several of them throughout this presentation, but some of the main ones include patient safety, workflow, and compliance. Some of the challenges include an upfront cost that a facility would have to pay to implement these systems. Obviously, the employees would need training to use them. And when it comes to downtime, different things that could be included when it comes to downtime are server failures, crashes, updates, power outages. So the facility always needs to have a backup plan in place, such as temporary paper charting. as we discussed, there are cybersecurity risks associated with this, so it's important to be protected as a facility. There's a need for provider oversight. Even though a lot of this documentation is automatically recorded, the provider at the end of the day still needs to verify. And technology complements clinical judgment, it doesn't replace it. So key takeaways from this presentation should be that the documentation burden is increasing, and unfortunately that falls on anesthesia providers. Fortunately, AIMS can serve as a solution by improving safety, workflow, and documentation, although it does have its limitations. So this being said, providers still remain responsible for documented information. So like I was just talking about, we need to go back in, make sure that first of all it's being recorded, and then after the fact verify it. Lastly, for facilities or health systems that want to successfully implement these systems, training, oversight, and a backup plan is needed. Thank you. And these are my references.